Welcome to the Mug Hub podcast, the ultimate platform for all things related to medicine's use, patient care, and the incredible world of pharmacy. We are your hosts, Connor and Sian, and we're thrilled to have you join us today.
Here at the Mug Hub podcast, we're passionate about empowering future pharmacists, expanding your knowledge and igniting your curiosity. Whether you're a first year embarking on your pharmacy journey or a final year getting ready to go out into practice, this podcast is designed just for you.
Across our series, we delve into 4 captivating themes that will take you on an enlightening and entertaining journey. From exploring intriguing clinical topics to showcasing the extraordinary individuals who make up our incredible teams, we're here to unlock the secrets of the pharmacy world.
So grab your favourite mug, settle in, and let's embark on an incredible voyage together. Get ready to be inspired, educated, and motivated as we unlock the vast potential of pharmacy and the vital role it plays in healthcare.
So, hello and welcome back to another episode of the Mug Hub podcast. Today,
We're on a road trip.
We're on a road trip. We've come all the way to Bordeaux in France.
The sun is out. Everybody's out. Well, all the pharmacists in Europe seem to be here. It's very, very busy. I mean, I'm sure there are still some working in hospitals. But as I look around, I can see a lot of pharmacists walking around talking about sustainability. That's the topic of the conference this year. There's a buzz. It's good, isn't it? It's exciting.
We've had some really interesting talks so far. So we've just come out of the second keynote by Peter Morgan at the NHS England, talking about the climate crisis and global health and the fact that we need to do more.
What were your thoughts on it?
I was really fascinated by, his takeaway message was do something.
Yeah.
So I think there's a lot of legislation that the UK have now put into place to make sure that we are going to hit this carbon footprint neutrality by, I think it was 2035 or 2040.
I think,
but I think like his take-home message for us was, do something.
Yeah.
Like take a bike once a week, eat a meat-free meal once a week, think about a reusable cup, which I think are all small things that we can just do.
Yeah, I liked that. What is your one thing?
What is my one thing? So I think I'm going to try more because I've got cups in the office.
Yeah.
So I take that down with me instead of using one of the disposable cups.
Brilliant. Love that.
I mean, I'm already vegan, so
yeah,
I think that kind of is a big tick from a carbon emissions standpoint.
Yeah.
But I think I'm not cycling.
It's
all
too
the way.
far,
I can't
Connor,
cycle
you can't.
30 miles.
Don't do that. But I will. Well, I won't. I'm going to walk. I'm not going to cycle. But I only live, I don't know, a few miles away from the university. So I'm gonna try to walk in twice a week.
Okay.
All right.
I think even if it's just once.
Even if it's just once, and I do occasionally walk in, but I need it to be a bit more of a, this is a goal. It's got to be at least twice a week.
Fab.
But yeah, you're right. Once a week would be something anyway.
Awesome.
Cool.
So Sian and I have been on a wander to find some interesting people around the conference centre, and we have somebody with us. I'm going to let them introduce themselves and just tell us a little bit about your role as a pharmacist.
I'm Sophie Leday, and I work as a pharmacist on the small island of St. Martin in the Caribbean. But previously I worked in the UK, trained at King's College and worked in the UK for about 8 years.
So it's a little bit sneaky because Sophie and I used to work together, but I bumped into her and I was like, right, you need to come and talk on this podcast.
Why not? You've got to pull in the favours where you can.
Yeah.
Do you want to tell us a little bit about what pharmacy's like, what your role is like in St. Martin's?
I think being in St. Martin is probably comparable to being at a smaller district general hospital, because I work at the local hospital over there. We are a small 70-bed hospital, and we are a very small team. So as the pharmacist, there's only 2 of us for the entire hospital.
Wow.
So as a small team, 2 pharmacists and 5 assistants, we do everything from outpatient dispensing to chemotherapy preparation to bedside pharmacy services.
Connor looks startled at that.
I'm terrified.
Yeah.
What was that? The chemotherapy preparation?
Yeah, because that involves quite a lot of knowledge and manipulations, and actually getting your hands in the isolators and stuff. So I think it's one of those challenges of working in small hospitals. You're kind of a jack of many trades. You're doing everything.
That's got to be quite different to what you were doing when you were working with Connor then.
Yeah, so in the UK, you tend to be in a small specialized team. You get a lot of support from upper management. Depending on where you are in your career, you manage a lot of younger pharmacists. But in this case, I considered myself kind of a mid-stage pharmacist, and I'm almost considered the boss over there with my colleague.
Yeah.
And then you're doing just about everything. You answer to no one, and you answer to everyone at the same time.
Yeah.
Yeah.
I mean, I was half discussing a conversation that we had during COVID with you in discussions with the army.
Yes.
I just wondered if you wanted to give us a little bit more on that, because it was quite...
Oh, yeah. So during COVID, trying to get because we order most of our medication from the Netherlands, so trying to get our medication over when there's no commercial flights. Our medication usually came in once a week on a KLM flight, and trying to organize with the Dutch Ministry of Health to make sure that we get authorization for our supplier to make it onto a military base.
Amazing.
To then fly our drugs over with everything else that the island needed at the time. And then me, myself, going to the airport and picking up my medication from the military plane and transporting it in my car back to the hospital.
Wow.
So yeah, there's a...
Yeah. It's not the traditional role.
It's not the traditional
No.
role, but being escorted by the pharmaceutical inspector to make sure that we weren't like pocketing meds and all
Yeah.
kinds of stuff. So it was quite intense and
Sounds it.
quite feet on the ground, doing a lot that you really don't expect to be doing in the UK, but you would probably do if you were in a smaller situation, a smaller hospital situation, maybe even the countryside. You never know.
Yeah, true.
And your training was in the UK as well?
Yes,
so...
my training was in the UK, so it was a big culture shock and a big change, but I think it did prepare me, at least the supervision that I had, the training that I had, the team that I had that tried to make sure that I learned not just about the clinical aspects of pharmacy, but management and so forth. It did prepare me quite a bit for going back, yeah.
Oh, it just proves the adaptability and the transferableness.
Yes.
Transferableness?
No, not a word. No.
The transfer of skills is
Yes.
like you can move it to those sorts of things and
Yes.
maybe be doing something you're not used to,
Yes.
but be able to apply those skills and work through it logistically, which is quite cool.
Which I think was, I kind of knew that was coming, I think, early in my training, so I didn't want to focus too early on. I made sure that when I started in hospital that I rotated to other specialties as varied as possible. Like I didn't focus on pediatrics or gynecology saying this is what I wanted to do. I knew that I would be faced later on, because I always wanted to go to St. Martin, that I would be faced with a situation where I would be having to take care of everything.
Okay.
So if you try and make sure that you get a varied experience, as varied an experience as possible, then it prepares you for that kind of situation.
It kind of moves on to the next
Doesn't
question
it?
a little bit.
Yeah.
So is there one piece of advice that you can think of that has really stuck with you during your career?
Yeah, don't focus on clinical. If
Okay.
you get early opportunities to do something else that will expose you to management or expose you to different types of problem-solving situations, even finance in pharmacy, take those opportunities. Because later on in your career, even if you are still a pharmacist and you choose to stay in a particular field, you will be faced with, managing people, managing budgets, all of those other things, and it's important to be exposed to that early on. Don't disregard those aspects of it.
Yeah, that's good, because I suppose with the clinical stuff, you're going to be faced with that in any case.
In any
And,
situation, yes.
And the other opportunities might not
Exactly.
come up so frequently.
And everyone thinks, oh, but I'm in pharmacy school and this is what my focus is. But
Yeah.
actually, when you're in the real world, there's so many other aspects that influence pharmacy. So if you're a horse with blinders on, you don't understand all of it and you don't see the bigger picture.
Yeah.
So
Particularly if you're a horse. It does make it harder.
yeah.
Clinical skills are relearnable,
Yes.
whereas all of the other transferable skills in the management and getting involved in legislation and stuff is, if you've not been exposed to it, you're never going to be able to pick it up. So
Yeah, and I think it helps picking it up early. So just even if it's a little tidbit here and a little tidbit here, following someone to a meeting or asking them if I can join you for this discussion, just even if you're not involved in the discussion and you're just observing, it prepares you a lot more than if you were handed a textbook and you're studying economics of healthcare later on, actually being in those meetings or being exposed to it's a better learning opportunity.
Nice. We're only midway through the conference, so this might be a bit unfair to ask, but have you got a takeaway message from the conference at this point, or anything that's been new or exciting for you?
I think what I've taken away is everyone in Europe is going through the same problems. Even in the Caribbean, I'm going through the same problems, because usually I think of me and St. Martin being on the Dutch side of the island, dealing with the Dutch healthcare system as my primary reference. I think, okay, this is what the Netherlands is facing, this is what we are facing, but actually Spain, France, Germany, they're all having similar issues. And I think from this conference you can see that, and you also learn everyone's ways of adapting to those issues. So it's an eye-opener, and it's also an opportunity to learn what they're doing differently that we can adapt to our situation. So far it's been good.
Brilliant. And I have to apologise, I called it St. Martin's.
It's
clearly St. Martin.
No, it's a common thing. I get Saint Martin, Saint Martin, Saint Martin. It's all over the place sometimes. Yes, I'm used to it.
Okay. Thank you very much.
All right, thank you.
Brilliant.
So, hello and welcome. Thank you so much for talking through your poster. If you'd just like to introduce yourself and where you're from.
Yeah, hello, my name is Stine, and I'm a pharmacist from Denmark, from the region of central Denmark.
Fantastic. And what's pharmacy like for you in your country?
I work in clinical pharmacy, and at my hospital pharmacy, we do a lot of education, both for nurses, doctors, pharmacy technicians, whoever wants to listen.
Wow, so there's loads of education stuff.
Yeah, also in Denmark we have kommuner, we call it, small parts of Denmark.
Okay.
We do some education for someone without the health background, but who work at facilities for disabled people.
Oh, okay. So they're not necessarily healthcare professionals, but they need to know that kind of information.
Because they have to give the medication to the patient,
Perfect.
and a healthcare professional will dispense the medicine, and then someone else will give it to the patient, but they need to know a little bit about medicine.
Well, it's really interesting because it kind of ties into, so we're stood by your poster, where I'd really like you to talk me through this. So the title is Using Virtual Reality to Introduce Newly Hired Nurses. So, what is this project and why did you do it?
We was contacted by the NIDO Center for Research and Education at our hospital. They had a simulation unit where they had brought some VR glasses, and they would like to make a video about a medicine room. And they thought that maybe we would be interested in being a part of it. Yeah, and we was like, of course we wanted to be a part of this. And then we made a video where one of the pharmacy technicians is standing in the medicine room and is talking about where to find the stuff and why it is placed in the places.
Okay.
And stuff. And then we use this video once a month, where we have a 4-hour session for newly hired nurses, where they come and see the video, and we talk to them about the medicine rooms at our hospital and the concept of medicine we have. We have a little bit of special concept of medicine at our hospital, where we use the patient's own medicine while they are at the hospital. So they have to be aware of that. So we do some exercises with them about the concept of medicine also.
Yeah, I mean, that's really interesting because you're obviously getting lots of people to see these clinic rooms but not actually have to go into them, because I assume they're not very big spaces.
Yeah, we have very small medicine rooms because we use the patient's own medicine and dispense it at the patient's room, not in the medicine room. So the medicine room is basically just a small room with extra boxes if they run out of something or they start up with something new. So we have to give them a box. So it's like the nurse go into the medicine room and pick the box and go to the patient. And then they do it
Yeah.
at the patient's room.
So, I mean, you're saying that you're using it once a month, so you've created a resource that's used regularly.
Yes.
What were some of the things that came out of this then? Do the nurses enjoy this way of learning?
Yes, they do. They say that it's like a nice variation to the education, and like it. I have some of their statements, and it's easier to deal with when you like have been there, but without really being there.
It's not so overwhelming.
Yeah,
Probably.
yeah, and we can take it easy because we have the 4 hours, so we have the time to talk about all their questions.
Brilliant. So, and from this then, have you got any other bright ideas? What are you going to do next?
I would kind of like to make a VR video of like the production area at the pharmacy.
Wow, that's
Because you cannot just go in there.
Yeah.
But it would be nice for maybe some of the nurses or maybe some of us who work in clinical pharmacy to know what they do.
Because there's no reason for you to go there, but it'd be interesting to know about
Yes.
it. Yeah, that's a good idea. And have you got buy-in from that yet? Have you been and spoken to anybody about doing that?
I have talked a little bit to the staff in the production because it has to be them.
Yeah.
It has to be them.
And they're excited?
They think maybe it's good idea, but right now we just have moved to the new hospital, so they have to just get
used to
used to where they are before they are ready to.
Sure.
But also the guys from the simulation unit think it's a nice idea, a good idea, because they also know you can just not go in there.
Yeah, and then like you said, when you've got the training videos, they exist and you can just use them time and time again as long as nothing needs updating. So that's fantastic. Thank you so much for your time.
You're welcome. Thank you.
So I am just walking into the conference centre for the third and final day. I'm a little bit sad that it's almost over, but it's been an absolutely fantastic experience. It's been great to speak to pharmacists from all over Europe to talk about specifically the topic in this year's conference is sustainability. Had a really good workshop, so Sian and I went to a workshop on sustainability and just thinking about all of the different options we have, so from how we can change policy, how we can think about public health, and how preventable disease is therefore sustainable. And Sian said a really nice phrase that stuck with me is, a healthy population is a more sustainable one, and actually the facilitator wrote that down on one of the slides, which is fantastic. And it's just been really good to kind of connect with people and talk about some initiatives in their home countries around recycling or reducing their carbon footprint, talking about, using more sustainable travel, de-investing in getting medications from outside Europe, so thinking about, also shortages, but that's also more sustainable to be local. And just kind of, it's been nice to connect with Sian and spend a few days kind of like thinking about some projects moving forward. So going into the last morning, there's 2 more sessions left. And then I get to enjoy a little bit of Bordeaux. So I'll touch back in after this morning is over.
Well, I'm back at the conference. It's the last day. It's about 5 to 9, just about to go into a session on looking after pharmacists' well-being. So let's go and see what it's like. I've just come out. It's not actually finished, but I've got to catch my plane back to London. And then down to Brighton, obviously. What a good session, yeah. A couple of good quotes that came out of it. Remembering it was on, looking after pharmacists, looking after teams, and very much about stress management. One of the quotes was, you can't pour from an empty cup. I've heard that before, but I like that. So we need to look after ourselves, and lots of helpful tips for taking little micro breaks and planning for stressful times. And I think that's lots of useful advice for us as staff, for you as students, now and when you become pharmacists.
So Sian has left me. She's gone off to get her flight back to the UK, but I've managed to drag 2 pharmacists out for a quick chat. So I was wondering if you could just quickly introduce yourselves and where you're working.
Oh, hello. So I'm Festine. I'm French. I am working in a small town hospital called Châteauroux, in a hospital. And this is what I am.
My name is Roisin O'Hare and I am here from Belfast in Northern Ireland, and I work across university in Northern Ireland as well as in a hospital.
That's fantastic. So we've got completely different countries. I wondered if you could just give me a little bit about what is a hospital pharmacist in your country?
So hospital pharmacists can be many things in France. As for me, I am working both in the technical field and in the clinical field. So I am managing cancer drug preparation, like the morning, and in the afternoon I'm managing the prescriptions in the cardiology unit. So it's more like clinical orientated thing.
Very good. So in Northern Ireland, obviously it's part of the United Kingdom, so it probably is more similar to what you're used to in Brighton. And again, a bit like Faustine has said, there are a lot of things that you can do. You could be working in aseptics, you could be working dispensary focused, but most of our pharmacists are actually working in clinical practice, and so they are admitting patients, they are prescribing for patients, medication review, reconciliation, that kind of thing. So my job is largely to teach undergraduate students about clinical pharmacy. So that's the bit that I do.
And you're both cardiology specialists.
I know.
I know. We have a common point.
And I just want to touch upon, actually, because we've been talking about prescribing in the UK, and I think you really interestingly...
Yeah, in France, in France we're just beginning to touch the subject of prescribing for pharmacists. We're really excited about it, but we're like leagues behind you, actually, behind the UK. So yeah, it's very interesting to see maybe what's going to happen in our country.
That's fabulous. So on that then, so if we move a little bit on, so our student pharmacists are going to be getting advice left, right and centre. I just wondered if there's something that sticks with you during your career, one piece of advice that you've been given that's kind of stuck with you. And if you can't think of that, a piece of advice that you could give to our student pharmacists.
I think for me, I remember somebody, well, it's probably 2 things actually, Connor. You know me, I can never just come up with one. But,
We'll let you have both.
Can I have both? Okay. So I think somebody said to me really early on in my journey to be curious. So to always kind of go, why? Okay, so, and I'm kind of renowned for that now, really. It's like there's the who, what, why, where, but the why is so important. So why are we doing it? You know, is it still a good idea? And that is important. But the other part of being curious is just to always look for things that aren't working. So the patients that fall through the cracks. We talk a lot about population norms and about most patients will do well on this drug, but what about the ones that don't? And I feel that as a pharmacist, you kind of live within that space. And the other thing that's a really important piece of advice...
Now you're making it 3.
Oh, no, is take every opportunity. So if you're offered the opportunity, do not say no. If you can make it work, make it work. Because sometimes it doesn't come around again. And when you're young, like you guys are, you think they do, and they really genuinely don't. And there's a few things that I wasn't able to make work that I have regretted, but not too many, because I say yes to most things. So try and live in that space as well. Say yes.
Not say yes to everything though, because I think sometimes you come unstuck, but you're right. And I think we've done lots of interviews with pharmacists in the UK, and it's been about their opportunities that they've said yes to. So think about it. Is it something that could work for you? And it kind of really changes your trajectory about what it is that you then have a fascination about. So,
completely.
Yeah. It wasn't necessarily open to you until somebody asks you, and then you're like,
that sounds fantastic. Yeah, exactly.
Go on. Have you got a piece of advice?
Oh, I think first I completely agree with you. And from the study point of view, yes, always search the why, be curious. And also for your professional path and career, also be curious. Do not be afraid to ask to older people. We are older people.
Yeah, exactly.
I mean, sometimes it can be intimidating, but do not hesitate. People are actually, most of us are really happy to share experiences. Yeah. And don't be afraid to ask. We will happily share all we know and advices.
I think that's really lovely, and that's right. Yeah.
I think so. Engagement and enthusiasm.
Yes,
we say
exactly.
this to our student
And even
pharmacists
if
all
you're
the
not
time.
like really sure about something, you don't need to be sure to be 100% convinced about something. If you're just even a bit curious or you're wondering, don't hesitate to ask.
Yeah.
This is how you make your own ID, actually.
I think you're right. Enthusiasm, I have to say, that's what I want to see in a student. I don't care that you know everything.
Yeah.
You try and you're enthusiastic about it. That is what we want from our students, I guess.
Right.
Sorry. I'm sure I should entertain you in the meantime.
Wow, so we have been joined by another fantastic colleague. I wonder if you could just introduce yourself and where you're from.
Hi, my name's Greg. I'm a clinical pharmacist from Australia, and dabble in a lot of things.
Well, tell us a little bit about what you dabble in.
Oh, diabetes, deprescribing, anticoagulation, a lot of research.
Fantastic. And we've just been talking about prescribing. So is prescribing for pharmacists a thing back home for you?
In Australia, it is not a thing. And I was just telling Claire an interesting story about a study done in Queensland, and they had recruited 600 patients successfully for urinary tract infections, simple urinary tract infections. Community pharmacists were doing the prescribing, and they applied for an extension of the process of the study.
It's interesting that you mentioned that, because actually Pharmacy First in the UK has come out in this last month, and one of them is uncomplicated UTIs and supplying prescription medicines without a prescription. So it'd be interesting to see what the data is that comes out of that. But I mean, antimicrobial stewardship is one of the tenets of pharmacy professions. We are the gatekeepers most of the time for antimicrobial resistance and making sure that they're used appropriately. So it's interesting that they've taken that stand and think that community pharmacies are going to be prescribing willy-nilly.
Yeah, look, the stewardship thing within hospital, I think there's a lot of opportunities. Anticoagulation is a big opportunity as well. There are others, pain management even. I think there's a lot of doors that could be opened.
Yeah. So you're almost up to scratch with the rest of them at this point. So the last question that we got to was, is there one piece of advice that has kind of stuck with you through your career that you can think of? If not, have you got any advice for our student pharmacists in their early stages of their career?
Oh, look, it's patience. Sometimes getting stuff done, except that stuff moves at a glacial pace, and you can change things, but there is an art to it. And sometimes there's a window, you have to wait. You have to think in terms of years, not just months, and that's difficult with the current generational cultures.
Yeah.
But you need to play the long game.
Play the long game, be patient, and keep pushing. Fabulous. That's great. And there's
I like that one.
a nice mix of advice as well. So the last question then is, so we've come to the end of the 28th European Association of Hospital Pharmacists Congress that's on sustainability. What is your take-home message? What's the one thing that you're going to take back with you?
I think for me, I have loved the fact, well, for me, I'm very much about what is the active thing that you can do either as a citizen or as a professional, and or as an undergraduate, by the way, as well. So it's thinking about where are we with that. So for me, it's about trying to distill the information from this into bite-sized chunks for our folks back home and say this is what you can do and make it really, really easy for everybody, whether you're an undergraduate or whether you are a practicing pharmacist or just a citizen. So I think that's, for me, the most important thing is like taking all of that sustainable stuff and saying, okay, this is what you got to do now, and measuring it, I guess, as well.
Wow.
Is that one thing or is that a few?
That's a few things,
Okay,
but I
sorry.
think that's
As usual.
fine. Yeah.
Oh, damn, you left nothing for us to say. Oh, damn.
That's exactly what I was going to say.
I agree with you. Yes, of takeaway message. Well, that sustainability actually touches the whole field of pharmacy, not just technical, but also clinical and, well, the whole thing, because I was a bit, not skeptical, but I was waiting to see how it would unfold when I came here at the Congress, and I was amazed to see that every field had a thing to say and had a stone to bring, to the whole construction of sustainability. And yeah, also I was amazed by the enthusiasm of everyone. Like, it really got me hyped up.
It's good to have so many like-minded people in one place. Greg, have you got one take-home message?
Coming from the other hemisphere, it's just nice to see that amazing enthusiasm here. And in terms of sustainability, it's more about, there's any number of issues, but our healthcare systems are generally not sustainable. And we just have to work smarter. We have to enhance the digital side of things. I know that our public healthcare system in the hospitals is crumbling in Australia, and I just everyone I speak to here has got the same issue. The patients are more complex. We need to do something differently.
Fantastic. Well, thank you so much for your time. Merci beaucoup.
Oh, de rien. Ce fut un plaisir.
Bonne journée.
Bonne journée.
Yeah, thanks, buddy. Thanks, mate.
And that brings us to the end of another captivating episode of the Mug Hub podcast. We hope you enjoyed today's discussion and took away valuable insights that will fuel your passion for pharmacy.
Remember to subscribe to our podcast and stay tuned for future episodes where we continue to explore fascinating clinical topics, introduce you to incredible individuals, and enhance your skills to bridge the gap from bench to bedside.
If you've any questions, topic suggestions, or you'd like to get involved, we'd love to hear from you. Connect with us via our social media platforms or send us an email.
Until next time, keep learning, keep exploring, and keep engaging with your studies. Thank you for joining us at the Mug Hub podcast.